Yeah, so like I said that there is a lot of gray area now when it comes to therapy and therapeutic strategies. Psychoanalysis back in the day was very clear. They used a lot of free association, dream analysis, transference, these sort of techniques. But now it's become more advanced. You have schema therapy, which is very, very popular in the United Kingdom, for example. It's used a lot. When I did schema therapy training, I actually had a professor come in from the UK to teach us, and what schema therapy does is that basically the idea, the theory that you have these maladaptive voices. Imagine the schemas as voices in your head where you are in a vulnerable situation and they talk to you, they tell you things, exactly things. For example, if you have an eating disorder and you are really craving, you want to eat something because you're so hungry and you haven't eaten. The maladaptive schema would most probably be a critical mother who would, whose voice would tell you, you're fat, you're ugly, nobody's going to marry you, you are not pretty, you don't deserve. What you're hearing is that I don't deserve my mother's love because I'm not perfect in the way I look. And overcritical mothers can be very obsessed with their child's appearance. So then you develop this maladaptive schema, which is actually an inner voice or inner you, but it's actually your mother through you, speaking to you. So imagine the schema is like that. So in this case, then you would have that schema activated every time you try to eat a meal. All you would hear is your critical mother saying how fat you've become. So this sort of schema therapy sort of is psychoanalytic because it goes back into your childhood traumas. It goes back into your childhood, into how your relationship with your mother was extremely volatile, and it affected you, and hence you developed an eating disorder. But what schema therapy, what it takes from CBT is that you actually play out within sessions, you actually play out these behaviors. So you are told to imagine, you are told to do a role play where you imagine going to the fridge and opening it and removing ice cream or whatever you think is forbidden food to eat. And the therapist actually stands behind you and starts to talk to you in that voice of your mother and use the same words and use the same dialogue and language. And you're taught to come out of that and still go ahead and eat anyway. You're taught to quiet down that schema and develop the healthy adult schema, which says it's okay, it's fine, I'm an adult, I can decide what I want to do with my life, what I want to eat, and it's got nothing to do with my mom. So through role play in sessions, therapists help you to come out of those maladaptive schemas. So that little part of it is CBT, like it directly changes your behavior. But the theory which it's based on is very psychoanalytic, and it's very based on your childhood and your traumas with your parents.